And thank you for being a co-compasser. Now is the time where I'm truly excited because I have the right culmination of beauty and brains together, and it's a it's my good fortune to actually have this lovely soul who's going to come and enlighten us about values in healthcare and a spiritual approach. VIHASA is the name, and VIHASA is the energy that we are exuberating right here for each and every one of you. So we have none other than Dr. Sarah Eagger, who is basically one of the most prominent figures when it comes to spreading positivity, and is the chair for Janki Foundation and past chair for Spirituality Special Interest Group of the Royal College of Psychiatrists, UK. And we have Dr. M. Balasubramaniam joining us, who's the Associate Dean of Medical Research, SRM Medical College, Hospital and Research Center, Kanchipuram. So he is going to take this session forward, and he is a member of the Asia Pacific International Molecular Biology Network, AIMBN, and has an extensive postdoctoral training at the Hypertension Research Center, New Jersey Medical School, USA. Once again, I would like to thank our platinum sponsor. A big thank you to Vakrangi for yet another hosting and sponsoring this particular session. With that being said, Mr. Balasubramaniam and Dr. Sarah, welcome. And sir, over to you.
Good afternoon, everyone. Is it audible?
Yes, sir.
Yeah, it's my great pleasure and also eager to introduce Dr. Sarah Eagger. Dr. Sarah Eagger is chair of the Janki Foundation. She worked for 30 years in the NHS as a consultant psychiatrist and honorary senior clinical lecturer in the Department of Psychological Medicine, Imperial College, London, and also worked in private practice for 15 years. She is on the executive committees of both the Religion, Spirituality and Psychiatry section of the World Psychiatric Association, as well as the Special Interest Group on Spirituality at the Royal College of Psychiatrists, UK. As a practitioner of Raja Yoga, meditation for over 40 years and a certified mindful self-compassion teacher, she is an advocate of a values-based approach to healthcare, one that embraces peace, love, positivity, and compassion for the benefit of oneself and others. Before the talk, let me say a few words. We have seen and continue to see the COVID-19 related challenging times. There is a say, blessing in disguise. Challenging times can be an opportunity to reflect and discover the best in ourselves and each other. It can also push us to think beyond our limits, go for an extra mile walk. Let me give an amazing information of new biology. As a medical biologist, I work on telomeres, end part of the chromosomes. There will be an age-related telomere shortening as we age on and on. Recently, it has been shown that there is an accelerated aging, too much of telomere shortening linked to several non-communicable diseases, including diabetes and cardiovascular diseases. Amazing information. Very recently, it has been shown that those practice spirituality, love, positivity, compassion, and kindness, able to maintain their telomere length. Amazing. It's actually a work by the Nobel laureate Elizabeth Blackburn of California. This is a way to increase our lifespan accompanied by health span. That is what we need. All the time, we are all thinking about how to process and manage our money. What Madam is going to tell is we should know how to process and manage our emotions. Over to Dr. Sarah Eagger. Thank you.
Thank you. Thank you very much, Balal, and lovely to meet you all. Namaste. It was very interesting to hear Dinesh Bugra's talk. He certainly outlined the effects of working in medicine when they are negative. But I'd like to share with you some ways perhaps that you can look after yourself, that we can overcome a lot of these challenges. So I'd just like to begin though by let's having just a minute of peace and quiet before we start. It's a lot of talking, a lot of information, and it's quite nice actually just to center ourselves and become present so that we're really listening to what's being said to us and we can just calm ourselves down a little bit. So allow me to lead you in just a very short meditation. So I invite you just to start by noticing what are the sounds that you're hearing, what's coming to your ears. It might be sounds in the building or traffic noise or bird song, some machines in your house, people around you. What are you hearing? And then coming in a little closer and just noticing your own breath. That gentle rhythm of breathing in and breathing out. And just consciously as you breathe in, just have the thought to breathe in peace. And then as you breathe out, just releasing any tension or stress. And allow your body to relax. Notice where you might be holding on to any tension, maybe your shoulders, your arms, your hands. Just let them relax. And then noticing any traffic of your thoughts. What's arising in your mind? What's arising in your feelings? So this ability to notice what's going on inside of me. And just allowing those thoughts to come and go. I'm not catching a train of thought. Things that have happened up to now or things that are going to happen in the future. Just put them to one side and allow myself to just go deeper and deeper into that sense of peace and stillness that lies deep at the heart of me. A calm, a quiet, and again, just remembering breathing in peace and calm and letting go of tension as I breathe out. So I hope that set you up nicely just to begin this session with a little moment of peace. I'm going to share my screen with you now. And what I'd like to cover in the next 45 minutes or so is just some of my own thoughts and understandings over my own career as a doctor and a consultant psychiatrist, a medical student, and what I've learned, and then how I've helped with a group of other people turn that learning into a program which we call Values in Healthcare. And I'm very pleased to say this program is widely available in India, and there's a group of doctors there who've really taken it up in a big way and are very keen to share the valuable lessons that it teaches. But I'll tell you more about that as we go along. So what is burnout? Now, I don't need to tell you this because Dinesh just gave you a whole lecture on what is burnout. And it's clearly a really serious problem. It's a serious problem worldwide for the medical and healthcare profession. And COVID has just made that 100 times worse. So it's a serious situation. And I think all the suggestions he made at the end were really valuable, that it is something that has to be tackled on many different levels. And so I'm not discounting the political, the organizational, the healthcare context on a management level. But what I'm mainly going to focus on today is more about what you can do as an individual. But this is only one component. All the others are equally important, but they're often a little bit beyond our control. So, as Dinesh very clearly explained, this effect of burnout, this sense of exhaustion leaves your morale low. There's a growing interest in something called moral injury or moral distress. So this feeling that what you came into medicine to do, to help people, to be with people, and what you're actually able to do due to all the constraints that he mentioned causes a gap. And this gap is quite distressing. And that can also lead to mental health issues. This word compassion fatigue, and I'd like us to go into this in a bit more depth towards the end. Do we really mean compassion fatigue, or is it actually empathy fatigue? And again, Dinesh highlighted this paradox of having to have professional kind of detachment when you're working with unwell people, but also to be warm, empathic, compassionate is a quality that patients really, really value in their healthcare professionals. And when you're a patient yourself, you notice what a huge difference that makes. So we might unpick that a bit as well. The high suicide rate, a real concern. And this lack of being able to ask for help, to be able to get help, really interesting. And of course, depression, alcoholism, and drug dependency. We had all the stats from Dinesh. So really this idea that we become distressed, we can't ask for help, and then we use maladaptive coping mechanisms to try and manage it. And this leads to this terrible cycle of increased mental illness, drug addiction, things like that. So why is self-care a kind of taboo for doctors? Now, this was a question that I was really interested in, and I've written an article with a co-author recently on that very question for the Journal of Holistic Medicine in England. And I'd just like you to look at these quotes and think, which ones do I resonate with? Which ones make sense to me? So self-care is not indulgence. Self-care is self-respect. An empty lantern provides no light. Self-care is the fuel that allows your light to shine brightly. When you own your breath, no one can steal your peace. Self-care means giving the world the best of you instead of what's left of you. Rest and self-care are so important. When you take time to replenish your spirit, it allows you to serve others from the overflow. You cannot serve from an empty vessel. And how you treat yourself is how you are inviting the world to treat you. So just thinking of those quotes, which one do you think, oh gosh, yeah, that rings a bell with me, that lands in my heart? And not to put too fine a point on it, I think. that really, as doctors, and especially as medical students, if you do not value yourself, if you do not learn to care for yourself, there's a high chance that this profession will kill you, or make you at least very unwell mentally and physically. So it's a serious, serious point we're making here. Really, self-care is so vital, so important, and that is in your hands to a very large extent. So it's not just drinking water and getting to sleep early, although hydration and sleep are really important. Self-care is taking a break when things are overwhelming, saying no to things you don't want to do, allowing yourself to cry, allowing yourself to feel those feelings, and asking for help from those around you and doing the things that make you happy. So it's a very deep subject, self-care. So we had this question: if self-care is so important to really the ability to function as doctors, why are we so bad at it? And so Sarah Eagger and myself wrote this article, and we'd both been thinking about it a lot. And there's some really interesting evidence when they were looking at burnout and they looked at air traffic controllers. They found that the ones who suffered most from burnout actually had better psychological health during this, earlier in the study. In the before bit, they had better psychological self. And it was almost like the more competent individuals, and I think Dinesh referred to this sense of perfectionism, that they strove the hardest to meet the internal and external professional ideals. And they describe this as pathological altruism. So there are people who really sincerely engage in altruistic acts, end up unintentionally harming themselves or those they are intending to help. And I think doctors can suffer from this for sure. And another study showed that doctors have higher rates of self-criticism, which is interesting. And again, Sarah and I were looking at this. Where does this harsh inner critic come from? What's driving us, apart from our good values to become a doctor? What else is driving us? What are our psychological needs that are really putting us in this profession? And she noted that for herself, you know, as a child, she was a people pleaser. She became a caregiver in the family, that she felt that by looking after others, that gave her a sense of being lovable, of being wanted, of being needed, of being valuable. So there can be some unconscious processes that are going on that are really making us, in some ways, want to go into this profession of caregiving, but that we override our own needs. And if you don't look at that in yourself, in a sense, if you don't really understand more deeply what's making you tick, what's driving you to give your all to this profession, and in some senses, if you're very highly motivated and your mind is very strong, you can override your body. You can kind of say, no, I can keep going without sleep. Oh, I don't need that. It's okay. I don't need a drink or whatever. And so you find that something else is overriding your need to look after yourself. So we need to calibrate that, recalibrate that, and really become aware of why am I not so good at looking after myself, and can I do something about that? And I'd like to read you a poem which a medical student wrote. And it's quite an interesting poem because you read it forwards and then you read it backwards, and you'll see the difference. And it's quite clever what she's done. And this came with our article. So when you read it forwards, it's called Compassion. With the medication that springs from the soul, you should treat your own health, but never forget you should do your ultimate best for your patients. Suppress the emotions, please. You don't need to spare yourself some compassion. You have to care only for your patients. You don't have to regard your feelings, the fatigue, the burnout, the heartbreak, the guilt. They will simply disappear with time. It is not true about that how healthcare professionals' feelings are real. We should remember this poem as a reminder. And now she asks you to read it backwards. And this is the bit that I think you really need to take in. As a reminder, we should remember this poem, that healthcare professional feelings are real. It is not true about how they will simply disappear with time, the guilt, the heartbreak, burnout, the fatigue. Regard your feelings. You don't have to care only for your patients. You have to spare yourself some compassion. You don't need to suppress the emotions, please, for your patients. You should do your ultimate best, but never forget that you should treat your own health with a medication that springs from the soul. So I thought, from a medical student, very wise words, just noticing how we really need to include ourselves in that circle of compassion, include ourselves in the circle of caring. And so how do we do that? And I like this quote, my friend, care for your psyche, know yourself. For once we know ourselves, we may learn to care for ourselves. And this is very deep. And this is what I mean about learning about myself, understanding what's driving my behavior, seeing where I'm self-sabotaging, seeing where I'm undermining my own health and well-being, and having some insight and wisdom into that. And how does this connect with values? And there's some very interesting work on burnout that really includes values as a very basic aspect of what you need to harness in order to help with burnout. There are other items as well. There are other aspects in dealing with burnout: workload, control over your work, what reward you get, the community you're part of, things being fair. But values were seen as a very important aspect of this as well. So these values are the ideals and motivations that originally attracted people to their job. They are the motivating connection between the worker and the workplace. So it's a good question. Do you understand your own values? Have you ever explored that in any depth? And when we're looking at even a definition of professional competence, wide-ranging skills, which some of them I'm sure you definitely are taught in medical school. So knowledge, technical skills, clinical reasoning. And these are what we might call the skills training, content-based. So they're sort of outside in. They're things that people are telling you and trying to get you to understand. But really, when we're looking at emotions, values, and reflection, these are inside-out skills. These are things that you have to learn about yourself, and they're process-based. And so we need training programs, we need education on how to really understand and access these inner resources. And that's what values in healthcare is all about. It's we actually developed this a little under 20 years ago, and it was a team of healthcare professionals. And I can show you the actual the book, the facilitator's manual. It's quite big if you get the printed version, but it's now available free online from the Janki Foundation website. And it's this personal and team development program. And as I said earlier, you're so lucky because there's a very active team in India. And if you want to take any screenshot, take this one, because this will tell you how to contact the Values in Healthcare team in India. And they're the ones who've really been working hard to make this program available to healthcare workers and students and doctors in India. And they'd be very happy to talk to you about how to introduce this program into your medical school or even a group of friends, whatever you feel might be worthwhile. And there's a YouTube playlist for all the workshops. So there's a really great resource there. There's a website and there's an email. So please take advantage of this offer, and I'll explain to you more about the program. So the program aim was to really apply core values in healthcare. What values motivated and guided us at the outset of our careers, and to bring new vitality to our practice by reflecting on these values. And the process was to really help you find your values, discover them. And I'd just like you to stop for a moment and think, what was a highlight? What's been a highlight in my working practice? What's been something where I've really felt alive? I felt I was working at my best. Just give yourself a moment to recall this. What was going on? What were you doing? Who were you with? What was happening? But you kind of had that feeling of, yes, I'm really in my flow here. I'm doing what I'm meant to be doing, and I'm giving of my best somehow. Everything's working well. And if we were in the actual values in healthcare workshop, we'd have much more time to unpick this and share with each other the stories of a high point in my working life, and then to try and think, what were the values that I was expressing at that time? What was emerging from me? Because really a value is what's important in your life. It's kind of like your moral compass. It's when things are really tough and you have to make decisions, or you're under stress, what's going to guide you into doing the right thing, as well as the knowledge, information, everything that you have. Your values are really your anchor. They're your rock about how to act and behave in life. So really understanding your values in some depth is really worth putting some energy into, and doing a workshop on it would be really helpful. The other things that we wanted to include in this program was the idea of holism, so that there was mind, body, and spirit. So we have a very inclusive idea of what health and well-being means. So looking after our body is one thing, and we all know we can do exercise, yoga, tai chi, swimming, walking, being in nature. All that's really important for the mind and the body and the spirit. And so acknowledging that we're beings that encompass these three realms and addressing each one is really important. There's a process called Appreciative Inquiry. Sometimes, we talk about people who look at a glass half full or half empty. So Appreciative Inquiry is looking at the glass half full. What's working here? What can we do more of? What can we build on? Rather than a more critical kind of negative approach. And that's shown to be much more productive. Positivity is really how we use our thoughts. You could kind of call it a spiritual CBT, if you like. So noticing how I'm thinking, what kind of thoughts are pulling me down, what thoughts are giving me energy and strength. Reflective practice, and I think, even Schwartz rounds, even Ballant groups, places where we can be together, feel safe, and share how we're really feeling without that stigma. So I think psychological safety is a really important aspect of groups of students and teams, team where you feel supported, a team where you feel you can speak your mind. This is all really important stuff. But ultimately also spiritual. So what feeds our soul? What's important to us as human beings, not just human doings? And that's, we felt it was really important to include that in our definition and our processes. So the PAC uses what we call facilitated experiential learning. So they're not lectures, they are workshops. So you're given exercises, and from what comes up in that exercise for you, you will have your own learning, your own realization. So it's supporting experience. You are the captain of your own ship. You are the person who knows most about you. But these are processes or exercises that allow that to emerge for you to explore and investigate some of these things. Understanding values and principles to be able to express them in work and in your personal life. And this idea of cooperation as a value, that we all work in teams, more and more so in hospital now, and certainly in England that hierarchy is being flattened, and there isn't this sense of the consultant on top and the person at the bottom, the student or the resident. There's a much more sense of trying to include everyone, be inclusive, and have a cooperative team culture. So the pack itself has several sections. It's the introduction, there's guidance for facilitators, modules, tools, and resources. And this is again where you can download the free digital pack if you want it, but I would strongly encourage you to also contact VIHASA India. So again, if you want to take a screenshot, this is a good one to take because it gives you the website. And it's built on several principles. So physician, heal thyself. So really that sense of we are the ones in charge of our destiny. We are the ones who can say what is best for me. Learning from experience was the second principle, so that you have this direct inner experience from exercises and meditations, visualizations, and that you could take it back to work, that it isn't just this theoretical airy-fairy thing, but something you can really use in your day-to-day practice. And when we looked at the modules, so we started with this introductory module of building resilience, and I think as Dinesh mentioned and others have written about, there's a little bit of a backlash against resilience, and I understand that, this sense that if you're strong enough and you're brave enough and whatever, you can stand anything. And it's not really about that, because obviously there are, organizations have responsibilities, governments have responsibilities and resources. So all those things are very important. And it's not like you should be a soldier going into battle and continuing against all odds, because part of resilience also includes acknowledging your own vulnerability. And we talk about the wounded healer and being aware of what's going on for us, and how suppressing or avoiding that is really just going to lead to trouble down the road for sure. So it's when we talk about building resilience, we're not just saying it's all down to you, but there is a lot you can do for yourself. And I think it's not taught enough. It's not taught deeply enough and explored enough, because I remember as a medical student myself, I would have just so appreciated having had some of these skills and having had some of these conversations. Then it would have helped me enormously. I really had to learn the hard way. So I think just creating a culture where we can speak about all this more openly, I think is really, really helpful. So looking at values in depth to address low morale, really being able to cultivate that sense of inner peace. Now, mindfulness is very big now. It wasn't so big 20 years ago, but there are many mindfulness programs, meditation programs, hatha yoga programs, many things you can do which help you to manage your own inner stress, your own inner peace, develop that. So we were looking at that. Positivity, this idea of looking at the half glass full, really helping in your attitude of appreciating what you have, what's working, building on that. Excuse me. Compassion. Compassion is a huge subject, and I'd like to spend a bit more time on that in a minute, because as a mindful self-compassion teacher, I've also gone into that in a great deal of depth. And I think it's an extremely helpful skill, self-compassion. And I strongly encourage all of you to learn how to do that, because it's something that will really stand you in good stead when times are tough. Cooperation, working in teams, and valuing yourself. So this sense of really, what does it mean to care for myself? Really give myself the value, the love, the kindness, the care, the attention, as if I would, even a loved pet or a loved one. Can I treat myself in the same way as I treat others? And then deeply connecting that to spirituality, and how do we understand the soul and what the soul needs. The soul needs to feel, to have meaning and purpose. The soul needs to feel connected to others or a higher energy. A soul has needs as well, which we need to address. So the learning tools of values in healthcare are meditation. So really that practice of going within, like we did at the very beginning, really learning to still your mind, even just for 30 seconds, being able to do that between patients, being able to do that while you're talking to people. And you can certainly do that. You can learn how to take in compassion and kindness for yourself and give it out to others actually while you're in the middle of an interaction. Really helpful skill. Visualization's a very powerful tool, being able to reflect on your learning how to really listen empathically, listen with presence, to be able to take in what's going on and listen properly. Appreciation, creativity, so through art, through drawing, through music, through other modes rather than just words and just references and, you know, medi-search and things like this. There are other ways that we can tap into things inside which are really very like a revelation and very healthy. And play, the ability to make learning fun. So this spiritual approach, you're trying to find that inner experience of your own core values, not what ours are, but what yours are. And so you can identify and express this, and it's a voyage of inner discovery. And when you do this, you start to, when you learn about other people's values too, it's a great thing to do in teams. When you hear about what's important to other people, it's a very strong bond, it's a strong connection, and it also helps you build respect and trust for each other. And this idea of values-based practice, a very deep one, but one that I was just reading the latest magazine from the Royal College of Psychiatrists, and they have won an award because their college has based its whole ethos on a value system. It includes inclusivity, includes diversity and inclusion, and it's a thread that's gone through all their programs and their policies, and they say it's made a huge difference to how they operate. So spirituality, what do we mean by it? I think it's got many different meanings, but for me, it's that inner journey that connects to myself, perhaps a higher energy, and maybe the environment, the community. And it means that I'm aware of and using my inner resources of love and peace and compassion. You know, I have innate spiritual qualities that I can tap into, and they're so useful in this job of being a doctor and being a healthcare professional, because, you know, often there's not a lot we can do because the person's dying, or they're just so unwell, or they're it's gone past the point of treatment. But you can be present, you can be a loving, connected presence. You can help that person leave this life and go on to the next chapter of their existence with equanimity, with peace, and that can be so powerful for people. I was just again reading in a journal this week from a priest who suddenly became very unwell, and he wrote about his experience in hospital and how it was the anaesthetist who recognized he was a priest and that he was about to go in for an operation that he might not survive. And he said, the anaesthetist said to him, would you like to see a priest before you go? And so they got the local chaplain in, and that was so important and meaningful to that man. And then someone else on the journey who just recognized his needs. And so you notice this as a patient. You notice when someone shows you compassion, when someone shows you love, that's really, really what's going to be important to you. So I also wanted to just acknowledge that it's going to be reflecting our true nature. It's going to be this idea of the inner peace, the love that's within me, is something that is beyond my personality. It's beyond my sex, my wealth, my gender, everything. It's something deep within all of us, this sense of love and peace that we are. And so for me, when I'm expressing compassion, when I'm working as a doctor, I feel I'm also expressing something of my true nature. And so it's very powerful, it's very strong, it connects me with other human beings. And it's also to do with our relationship to suffering, because as doctors, we are encountering suffering every day, all the time. So it's something that we have to get to grips with. In what is our relationship to suffering? And I think, as Dinesh pointed out, this paradox of having that professional detachment, but also being empathic and compassionate. And it seems like they're pulling in opposite directions, but I don't think they are, because I think there's a way, when you tap into that inner peace in yourself, that you can have a sense of detachment, but also be very present and compassionate. And the Dalai Lama gave this beautiful quote: for someone to develop genuine compassion towards others, they must have a basis upon which to develop compassion. And that's the ability to connect with your own feelings and your own welfare. So you really have to learn how to care for yourself. And as you care for yourself, you'll become better at caring for others. And why I feel compassion is such an important quality, an important value, an important energy. And I could give you a whole talk, a whole workshop just on self-compassion. It has the components which apply both to others, but also to ourselves. So the first thing is attending. So first you have to notice. And that was what we did in that little meditation at the beginning, just to notice, how am I feeling? How am I? Where are my thoughts going? What's coming up in me? And for others, just to notice, oh, that person's in pain. That person doesn't look good. We know all the clinical signs and symptoms, but we're attending. Understanding what's causing the distress. So we are analyzing, we're diagnosing, understanding what's underneath. Empathizing. Now, empathizing is very interesting, because empathizing is this feeling of feeling what the other person's feeling. It's a product of our mirror neurons, and so we can sense what's going on for other people. But in all meditation practices, they say it's good to empathize a little bit, but not too much, because you don't want to go down. You don't want to feel exactly what someone else is feeling. You just need to touch it. So you really have that humane response of, gosh, I know what this person's going through. And as psychiatrists, you use it a lot. It's called affect. You know, if someone's really sad, you feel it, you sense it, and it's a powerful clinical tool to know what's going on, but it's not going to help you if you go down into that sort of pit of despair as well. So empathy is an interesting skill to touch and notice what others are feeling and feel it a bit yourself, but it's not going to help you ultimately. It's the compassion. And they've done brain scans and shown that the bit of the brain that lights up when people are feeling empathy is different to that was when you're feeling compassion. So that's what I mean, that compassion really isn't, it's not compassion fatigue, it's empathy fatigue. And so the other thing is this feeling of helping. Finally, compassion is very active. Compassion wants to do something to help relieve suffering. And even if it means, as I said, there's nothing practically you can do, but you can be present. You can be a compassionate presence, just being with someone as they're going through what they're going through. So as I was saying, the difference between empathy and compassion, so this understanding of, in other words, this kind of resonance, empathic resonance, but with compassion, we add warmth and we add kindness. And it's this feeling of empathy. I know what you're feeling, and this true nature of love that comes from me is what compassion is. And it's a very positive emotion. And what they've noticed again with the brain scans is that when people were experiencing compassion, that it was energizing. And so that's why these self-compassion practices are really important and important to do on the job, because they do energize you rather than drain you. And it's this feeling to give ourselves compassion when we are experiencing empathic pain. So I might be sitting with a patient who's suicidal, and I can feel they're very sad. they're very low in mood. They feel so bad their life's not worth living. And it's hard to be with someone like that. It's hard to sit in the presence of people who are in such despair. So I'm actively taking in compassion for myself. I am actively soothing and calming my own mind so that I can, and then I'm sending that energy out to them as well. But it's acknowledging that sitting with other people, being with other people who are in pain and suffering for whatever reason is not easy. And so you have to look after yourself kind of emotionally and spiritually while you're in this situation. And this brings us to the final thing of really, what does this bring ultimately? This feeling of equanimity. So where those paradoxes of being detached but also loving come together, maintaining that mental balance. And this, for me, has been a journey of a deep spiritual understanding of the transient and interdependent nature of reality. So it's really seeing the bigger picture. And I think that really helps you to see the bigger picture, because otherwise you can think, why is this happening? Why is this person suffering so much? You know, you just have huge whys in your mind. So really step back, see the bigger picture, and that's what a spiritual journey will help you. And so your caring is then based on an emotional, you're able to be emotionally close, but you have discernment as well. You can see that you're not a rescuer, that you're able to help where it's appropriate and just step back where it's not. So this sense of equanimity gives us the emotional space to be compassionate whilst remaining in connection with others. And mindfulness, meditation practices, a spiritual journey will help lead to this equanimity, which will give you wisdom. And so just before I stop, to say that we have developed a free app. The Janki Foundation is a charity in the UK, which actually exists to support a hospital in India, in Rajasthan. We raise money for a hospital in Mount Abu. And we have developed this free app called Happy Dose. And these are 10 stressful scenarios with little 3-minute meditations that can really help you just calm yourself down. And they were all scenarios that we'd experienced in our work life. So it's free, and please download it and use it, because it's there as a resource to help you. And also in lockdown, I co-authored a book called Stillness in the Storm. Again, there's an e-version of this, and it has audio tracks attached to it, where I'm going through these steps. It's a personal step, how to cope with fear and uncertainty. So creating inner safety, being present, loving myself, stepping back and accepting, empowering myself, connecting, discovering inner peace and wholeness. So it's easily read. It's a small book, and I think you'll find it really quite a helpful resource to learn some of these skills. So thank you. I think that's me done just in time. And over to you, Bala, for any questions.
Yeah. Yeah, thanks for the excellent, actually, talk, sharing your experiences. They're very, very important. There is one question. Can you please guide us how we can be a part of VIHASA? Can we become a trainer so that we can spread this positive movement within our community?
Is that person from India?
Yeah.
Yeah. I think I gave the slides with how to connect with VIHASA in India. Did they see that? Do you want me to show that slide again? Should I do that?
Can you please guide us how we can be a part of VIHASA? Can we become a trainer so that we can spread this positive movement within our community?
Yes, I think you can. You just need to connect with the Values in Healthcare team in India, And on the slide, I gave you the website. So it's www.vihasa.in. So there is a website for India. And if you email vihasaindia@gmail.com, then you can ask them how you can get involved. Is that okay?
Okay. One more question. Do you think that having titles that we all aspire or have achieved in our medical field become a hindrance of our egos to acknowledge, ask, or even accept them so that we can share and seek help from our peers and our near and dear ones?
What was the first part? I didn't hear the first part.
I said, having the titles that we all aspire or have achieved in our medical field, that it forms as an ego.
Yes. I think ego is a very interesting question. And in fact, I've done a series of workshops with the Medical Protection Society here in the UK, Medical Defence. They realised that many of the problems that arise, legal problems, are because of doctors' ego. And they recommended a book called Humility is the New Smart. And I have to say, it's a really good book. Just Google it. And it really makes you see that if you want to work well in teams, to show good, compassionate leadership, humility is such a great quality, such a great value, because it brings out the best in other people. Whereas your ego, it's, I agree, all these titles and what we're striving for, that doesn't bring out the best in other people. It just makes us more competitive. So ego is an interesting topic, and we need to understand our own egos, and we need to be able to really appreciate others, to be able to say what I don't know, to be able to show my own vulnerabilities. Maybe these are things that women are better at than men, I'm not sure. But I think these are things that are coming up now under compassionate leadership. These are qualities that people recognize are actually strengths and will help you and your team to grow and flourish.
I have a couple of questions. How do you define the contemptness in psychiatry terms? Contemptness.
I didn't catch that word. Sorry, Bala.
Contemptness. Can you define contemptness? Contemptness.
Contempt.
Okay. This is my contentment.
Contentment?
Yeah.
Contentment. All right.
Yeah.
Contentment.
The contemptness.
Oh. Contentment is contentment's a very deep state of being, because I think to be content, truly content, has a lot of spiritual wisdom within it. Because there, like in the book that I was saying, to be content, you need to accept what's going on, in some senses. You need to be able to accept reality and not be resisting it. And that requires, as I said, seeing the bigger picture. Being content is connecting to your own inner strength of happiness, which I believe is a spiritual quality we all have. So I think being content is quite a multifaceted quality that has lots of things within it that maybe we can work on. And what would you say, Bala? Do you have a feeling yourself what contentment is?
Well, people are thinking actually, because everything, we are aspiring, without any contentness. That is why actually, you feel always actually some emptiness.
Yeah. Yes, and I think this is due a lot to our materialistic society, and that we think if we have this and have that, it's going to make us happy. And then when we realize it doesn't, then we get disappointed. But also I think as professionals, it's really worth thinking about what's driving my behavior. And I used to work in a private practice in the city, and I would see this a lot with people in the financial sector as well. And they for them to understand, why is it so important that I succeed in this? Why is it so important that I make so much money? Why is it important that everyone respects me and looks up to me? And they'll find something in their childhood that they're running away from, and even when they get all those things, because they haven't looked at the underlying thing that's really driving that behavior, they still don't feel happy. They think it's going to help. And that's when they end up, with a psychiatrist, I guess, because they're feeling unhappy and then ultimately depressed. So I think we're too much skewed to looking at things from a materialistic point of view. And I think that is especially why this series is putting an emphasis on the spiritual and what are the inner resources that we have that bring out the best in us. And that will improve our relationships, it will improve our communities. And that's why that emphasis is so important.
So when failure occurs, how the team leader in a medical field should face it?
Say that again?
When failure occurs.
Right, yes. When failure...
How the team leader should face it.
Yeah, I think what's so important, and when we talk about psychological safety in teams, there's a thing about psychological safety which means if you have a blame and shame culture, people just shut down. And yet, if you have a culture where people can say what they really think, they really feel like I can be myself here, then it will be a much more effective team. And part of that is when mistakes happen, it has to be seen as a learning opportunity. What did we learn here? What will we do differently next time? That's what is the key to that, rather than who's at fault here, who can we blame, who can we shame, because, that just, again, decreases morale. So every mistake is a learning opportunity. We all make mistakes. Obviously, if it's something really catastrophic and regular, if it's malpractice, that's a different situation. But before you can create a safe team, if when mistakes are made, it's looked at in a learning environment and people aren't made to feel bad about it. And then people will confess more when they've made little mistakes because they know they won't be blamed and shamed. And so then you build up a much safer team because people are allowed to speak up and notice if things aren't right. Often in a very hierarchical team, the lowest people on that team might notice that something good is not happening, but they're afraid to speak up because they think the higher ups are going to put them down. And so they could have prevented a mistake or something bad happening, but they were too frightened to speak. So you have to create, as a leader, you have to create a culture where people feel their opinions, their observations are valued and accepted.
Never talk, actually, I have seen almost you covered 100% of all the terminologies. One thing I maybe missed or I didn't see is empowerment.
Empowerment.
Can you comment on it? Yeah.
Yeah. Well, I mean, for me, empowerment is a lovely word, and it's a sense of when you're helping other people that you're helping them to take charge of their lives. You're helping others to make the best of themselves. When we're a helper or a rescuer, sometimes we're helping others to make ourselves feel better, and we subtly want them to depend on us. But really, the best kind of leadership, the best kind of help you can give, it's the very oldest saying about that is, isn't it? Rather than giving someone fish, teach them how to fish. So again, with our patients, really helping them to stay healthy and happy, giving them tools to not need you so much is empowering others. And empowering others really, for me, is the greatest compassion, because you can see their suffering and you don't want them to go on suffering. So within my book, I do give some very nice tools, things that empower us. And the tools I talk about there are forgiveness, hope, being able to see appreciation. So sometimes there are things that disempower us, and it's often holding on to resentments from the past. It's often having thoughts that go round and round that we can't stop. So empowering ourselves, there are definitely some tools we can use that help to make ourselves stronger. But it's a very deep topic, but a lovely word. Thank you for sharing it.
If there are no any questions, actually, I would like to thank Dr. Sarah Eagger for this excellent, actually, down-to-earth, actually, talk. Thank you, ma'am.
It's a pleasure. Namaste. Thank you for inviting me, and may you all go well, be happy and empowered.